Good afternoon, everyone, and welcome to the launch of the APLMA Leaders Dashboard 2021. I'm Pooja Jain, and I will be your moderator for the event. Today's launch event is part of the APMENxChange webinar series supporting information and knowledge exchange within the Malaria Network. We'll wait for another 1 minute and we can start then. Okay, before we begin, I would like to briefly share the mechanics of the webinar. Should I do? Thank you. As you might already be aware, the audio and videos of attendees are disabled, but we encourage you to share your comments in the chat box or type your questions in the Q&A box. These options must be available to you at the bottom of the Zoom screen. We will begin with a short presentation sharing key milestones from the latest 2021 iteration of the APLMA Leaders Dashboard. This will be followed by a wonderful panel discussion to delve into the upcoming policy reforms in the region. We will close with a short feedback session to hear your views on how we could enhance the APLMA Leaders Dashboard moving forward. I thank everyone again for joining us so promptly. I would like to now invite Dr. Sarthak Das, CEO, Asia Pacific Leaders Malaria Alliance, to deliver the welcome remarks and present the APLMA Leaders Dashboard 2021.
Thank you, Pooja. Thank you, Pooja, and thank you, dear friends and colleagues, for making the time to join. Although we are calling this the APLMA Leaders Dashboard, in reality, this dashboard is the dashboard of the region. We're greatly honored to welcome our colleagues from governments and programs around the region, Ministries of Health, our colleagues from WHO region, Sierra, Wipro, EMRO, and partner organizations who work in tandem with governments to make all of this possible. I'd like to extend my special thanks to our colleagues from the Solomon Islands and the Philippines for taking time out of their busy schedules to participate in the webinar today. I wanted to begin by saying, to set the stage, that this is very much, and if we could turn to the slideshow, please. As we look to the dashboard and as we engage in this discussion today, I think it's very important for us to remember some basic truths. Next slide, please. Firstly, that we are coming together at this time to think about malaria elimination as a regional proposition. And we know that elimination happens not at a country level. Elimination doesn't happen at a provincial or state level. It happens district by district, block by block, in terms of the action of elimination. And at the same time, for us to reach the 2030 goal, what is required is for all countries to have successfully reached this goal. Our mandate in terms of the APLMA Leaders Dashboard is to track progress against key milestones in the region. There is currently a tool, the tool that we're discussing today, that is mapped towards roadmap priorities, which was developed by countries in the Asia Pacific and endorsed at the East Asia Summit in 2015. It has since served as a platform to highlight best policy practices, to show what bottlenecks may exist, and to serve as an advocacy tool to demonstrate progress in the region. There have been substantial improvements and the achievement of several milestones across the region. Here we'll just discuss an overview of a few of these. In 6 different countries, 6 policy milestones turned green. Nepal, Laos, Timor-Leste, and Vietnam successfully established national elimination task forces. Myanmar and Cambodia have successfully initiated their elimination financing sustainability plans, and 10 Asia-Pacific countries have achieved all the policy milestones of the dashboard, with Cambodia, Vietnam, and Timor-Leste joining the list this year. This progress is a testament to the commitment made and urged by government leaders at the 2021 Asia-Pacific Leaders Dialogue for Malaria Elimination, where we called for a whole of government approach and stressed the importance to transition from external funding. Next slide, please. At the same time, while we continue to sustain this tremendous progress in the region, the overall malaria case burden has reduced by almost 10% across Asia Pacific, according to the 2020 data issued through the World Malaria Report. 15 countries in the region successfully achieved the GTS milestone, and 8 countries committed to the E2025 initiative. However, I think it's equally incumbent upon all of us to look at what isn't going on track as much as what is going on track. And to that point, if we could look to the next slide, please. While we see this tremendous decline in malaria cases and deaths in the GMS and remarkable progress within India, we've seen a doubling of cases in PNG since 2015. While in Indonesia, there has been tremendous progress, we know that in the eastern part of Indonesia, in Papua, West Papua, and some of the neighboring provinces, there continues to be very high endemicity of malaria. And in total, that's 2 billion people who continue to remain at risk across the region. So the dashboard and our work together requires us to both think about how we can reflect on the successes and ensure that the job gets finished, while at the same time not losing sight of our brothers, sisters, and neighbors who need significant effort to be able to prepare for elimination. Next slide, please. The way forward for us is certainly to continue to use the roadmap as a way to guide forward for the region, but I will be very honest that the roadmap speaks in very broad general terms. And as many of you know, and many who have agreed to join today through the APMENxChange, this is ultimately an exercise which is on the one hand technical, but on the other hand political. We need to think about these very broad, we need to think about this in these very broad categories, because those are the messages that we can elevate to initiate political change as relevant in terms of the various roadmap priorities that are outlined here. But at the end of the day, elimination will require us to think carefully about what needs to happen, as I said, at a district level, and the ability to elevate subnational data within countries so that that data can reach the highest levels of political leadership to enable countries to achieve the final goal is critical. So I want to say one last piece before I turn this over. The point of today's session is very much to think about how we can take the dashboard moving forward and rethink its utility, and therefore we are quite conscious that given the varied burden in the region, we want to be able to improve the dashboard, to add new indicators that report on policy implementation status, that focus on subnational trends of hard-to-reach populations, so that we can continue to report on progress achieved and inform our in-country partners in a more robust way. Therefore, this program has very much been laid forth. There is a structured discussion which offers an opportunity for those who have joined to weigh in. Of course, this is just the beginning. A simple webinar will not be the way that we can figure this out, but we hope that it can at least provide us an introduction to how we can begin to think about making this more relevant moving forward. And with that, I turn it back over.
Thank you, Dr. Sathak. I will welcome everyone to access the dashboard using the link pasted on the chat box. If you have any feedback or concerns on the dashboard 2021, you can use the Q&A chat box or message us directly at dashboard@apelma.org. I once again welcome everyone. So I would also like to congratulate the National Malaria Programs and partners for the milestones achieved and applaud their efforts to maintain services even amidst the pandemic. We will now move to the panel discussion on upcoming policy reforms that will be moderated by Ms. Amita Chebi, Senior Director, Asia Pacific Leaders Malaria Alliance and Asia Pacific Malaria Elimination Network. And she's joined by distinguished officials from the Philippines and the Solomon Islands. Over to you, Amita.
Thank you, Pooja. Good morning, everybody. It's a great pleasure to welcome all of you to the APLMA Leaders Dashboard 2021 launch event. I'm Amita Chebi, and I'm moderating this discussion on upcoming policy reforms that are being proposed by countries to accelerate progress towards elimination. One of the key takeaways from the Leaders Dialogue that was hosted last year was the importance of collaboration between ministries across diseases and across borders to achieve the malaria elimination goal of 2030. The COVID-19 pandemic response in the region, as highlighted in a report that APLMA published last year, also showed that cooperation and joint effort across sectors is crucial to sustain disease efforts in times of a global crisis. So on this note, I'd like to welcome our panelists today. Dr. Razel Nikahao, Director, Disease Prevention and Control Bureau, Department of Health, Republic of the Philippines, and Dr. Albino Bobagare, Director, National Vector-Borne Disease Control Program, Ministry of Health, Solomon Islands, to share their experiences with continuing malaria service delivery during the pandemic and the policy reforms that are being proposed by their programs to improve collaboration. Thank you, Director Howe and Dr. Albi for joining us today. I'd like to first start off by requesting our panelists to share any key initiatives that were undertaken by the Ministry of Health in their respective countries to improve collaboration across sectors, across borders, and how this would help accelerate the elimination goal. So we'll start with Director Howe from the Philippines. Good afternoon, Director Howe. Last year, your Ministry of Health shared guidelines on the establishment of an integrated elimination hub for malaria and lymphatic filariasis. Can you please elaborate on how this aligns with the National Malaria Elimination Strategy and what have been some lessons and learnings from that experience? Over to you.
Yeah, thank you, Amita, and good morning and good afternoon to everyone in this call. So yes, in 2005, actually, the Department of Health tried to consolidate all of our initiatives on all of our disease-free zones. And one of this initiative is to integrate our program on elimination into an integrated elimination hub. It's actually 5 diseases in total: malaria, filariasis, rabies, schistosomiasis, and leprosy. But there has been significant attention to the integration of malaria and filariasis together. So when this was implemented, it was really because our data has shown that especially malaria and filariasis, are endemic in the same areas or in the same provinces. And mostly it's probably because also of the same mosquito vector that causes these disease. So because they are in the same area and because some of the strategies are the same, like the vector control strategies remain the same, the border control strategies remain the same, we integrated those two efforts initially into 63 different elimination hubs. And since then, we now have 62 out of the 82 malaria provinces declared as malaria-free and 44 of the 46 target provinces to be filariasis. So this hub integrates the diagnostic capabilities, the laboratory supplies, the drug and commodity distribution mechanisms, and even some of the interventions that need local government support, such as like the surveillance, health promotion, and case detection measures. So we can go into more details later, but basically the fact of integrating it also caused some efficiencies in the health system. And because of this initial successes, we're also considering thinking of all of the other diseases and integrating more into a more comprehensive national elimination plan. Thank you.
Thank you. That's incredibly interesting, and I think definitely resonates with what we're seeing from some of the other countries as well, around the focus on integration and finding cost optimization, particularly in the time of a crisis. And it sounds like Philippines has some very exciting case studies on this that the rest of the region can certainly learn from. Moving to Solomon Islands, Dr. Albi, we understand that the Solomon Islands has proposed a multi-sectoral national advisory committee for malaria elimination that is headed by the Prime Minister's office. Sounds like a very interesting committee. So could you just elaborate on what is the role of the committee? How do you see this supporting the country's elimination plan for malaria in particular? Over to you.
Thank you, Amita, for the question. And thank you for the opportunity to participate in this panel today. So Solomon Islands has come a long way in fighting malaria, as you know, considering the unique health system challenges our country faces due to its geographical distribution of several large and small islands. We almost eliminated the disease in the 90s. However, the progress was not sustained, and we are again facing an increased burden. Even with this little setback, Solomon Islands is committed to ensure that we still continue to strengthen our response towards malaria elimination. So as part of our roadmap for malaria elimination, we have envisaged that all government ministries, provincial premiers, national leaders from churches, faith-based organizations, civil societies, commit to work together to malaria elimination. The goal of the National Advisory Committee for Malaria Elimination is to adopt a whole of government and all of country approach to eliminate malaria. This is essential to ensure Solomon Islands continue to sustain its malaria control and elimination efforts. This, for us, will ensure that there is cooperation across all stakeholders, including government, private sector, academia, in addressing the issue of malaria. It will provide the necessary guidance and coordination needed at the national and provincial level and across all sectors in ensuring universal malaria service delivery, as well as monitoring progress towards elimination. The plan is to include experts from across the sectors, including various government departments, finance, development, etc., research, and academia, private sector, civil society, and health experts, focused on the intersectoral collaboration with representation from all relevant government ministries and professionals from not only national but provincial level, to strengthen implementation of malaria activities on the ground. The advisory committee, led by the Honorable Prime Minister, will also support advocacy activities and mobilization of support across sectors, including national and provincial malaria programs, to seek out collaborations, opportunities with stakeholders, partners in private sectors and regional malaria partners for sustainable implementation of malaria agenda, elimination agenda. Thank you very much, Chair.
Thank you, Dr. Albi. This is a very interesting initiative. And in fact, the Leaders Dashboard tracks this as one of the indicators in terms of, countries' ability to set up an overarching committee. I think some very interesting ideas that are emerging from this discussion. One is we heard from Dr. Howe on the potential for integrating disease approaches, disease elimination approaches. In the Philippines, you've seen how they've integrated malaria and lymphatic filariasis, but also Dr. Albi really recognizing, as from the case in the Solomon Islands, that for that integration to be effective and really take place on the ground, you need overarching kind of a coordination mechanism, which in Solomon's has obviously been through this national committee that's been set up, but also really hearing you say that it's important to have those kind of coordination mechanisms at the national level as well as at the subnational level, and I think that's a very important point. So now we would like to pivot the conversation to discuss the pandemic response and specifically hear your thoughts on how these initiatives played a role, not only in accelerating malaria elimination, but also really helped to improve health security. So starting with the Philippines, Philippines has managed to make substantial progress since 2010 on malaria elimination with a 68% decline in the number of cases. However, progress has stalled in the last few years. So what have been some of the key challenges as you enter the last mile of malaria elimination? Did the COVID-19 pandemic exacerbate the malaria burden in the region? And how does the program plan to adapt its strategies moving forward? Director Howe.
Yeah, thank you, Amita. And this is a timely discussion because we've been having these local discussions also on how to basically, our issue right now is really this last mile. A lot of the progress has been made prior to the pandemic, and as we assess our data, we see that the numbers that we're seeing are really concentrated on these two provinces. And actually, even going deeper, it's not just in the provinces, but really in select areas of our indigenous population. So although our active case finding has help, especially in the first parts of the elimination plan, really now the struggle has been to look at the specific practices of this indigenous population. So one of their, how do you call this? The way that they get living is through some specific agricultural practices that promote the preponderance of the vectors, no? And this is really something that even before the pandemic has been the cornerstone of why there are issues in controlling in these areas. But even though we've seen a lot of decline in the other areas, in these specific areas, we're also seeing some signs of progress. So for example, as I mentioned, actually looking lower scale, it's really just in these specific areas. But in these specific areas, there's still reduction in severe disease, reduction in pregnancy, reduction in child infections. And the COVID pandemic actually helped us see that because of some of the restrictions in lockdowns and in cash assistances, some of them were kept from doing their usual practices and the exposures. So, so basically what I want to highlight is that this last mile is really a stretch for all of us, and it forces us now to be more inventive in ways that we can address this pandemic, this elimination strategy. And that's why in this last stage also we're working and we're planning to work more closely with the local leaders and the LGUs to make sure that the access would always be available for these interventions. And as I mentioned earlier, integrating these interventions to actually routine practices, like to their practices in terms of their livelihood, their practices in terms of some of their communities. So I guess that's a brief overview of what we've been doing, but the pandemic had its pros and cons. It had impacted our implementation of spraying, our commodity distribution, our case finding activities. But as I mentioned, it also actually slowed some transmission because of the cash assistances and lockdowns, which was actually the main point of why transmission continued to happen in these provinces. Thank you.
Thank you, Dr. Howe. I think you make a really important point there about the long tail of disease elimination. You know, the last mile is often the hardest, it's the longest. And I think the fact that there's a really strong need for innovation and creativity, and that business as usual will not help you get through the last mile. So again, you know, the themes of integration, looking at, you know, innovation, community engagement, you alluded to that as well. I think that's going to be a really critical element of any country's last mile approach. Dr. Albee, COVID-19 has resulted in strengthening coordination and collaboration between ministries. And in the Solomon Islands in particular, do you think greater interministerial collaboration will lead to improved coordination at the provincial levels as well, both for malaria as well as the COVID response more broadly? Dr. Albee, you're on mute.
Yes, again, thank you very much, moderator, and thank you for the question. Yes, COVID-19 has definitely strengthened the coordination among our ministries. If you have experience working with the small island developing states, you will know that the finance teams, the procurement teams, the planning teams, etc., as small as they are, they remain the same teams that are now expected to respond to the COVID-19 pandemic, while simultaneously ensuring continuous routine for health service and the core business of the ministry. So how have we tried, managed, and coordinated our COVID-19 preparedness and response? So right from the onset of COVID-19, we have mobilized political support with the establishment of the Oversight Committee in early 2020, also led by the Prime Minister's Office, and was the mechanized that provides strategic advice on whole of government planning and response, which comprise of officers from Prime Minister's Office, from the Public Service, the National Disaster Management Office, the Royal Solomon Islands Police Force, the Border Management Unit, Health, Finance, Planning, Infrastructure, Immigration, Customs, Biosecurity, Education, Ministry of Foreign Affairs and External Trade, and with inclusion of the Solomon Islands Red Cross Society and the International Organization of Migration. So we reactivated the National Health Emergency Committee in January 2020 and engaging all relevant key stakeholders. We also developed the COVID preparedness and response plan aligned to a budget, which details what was needed, what it would cost, and the timing and location of the needed interventions. We also prioritized the activities within the plan so we can be clear on which activities were immediate and which ones could be attended to later. We established a COVID-19 financing committee to coordinate and monitor the increased development assistance received. While most assistance received was in response to preparedness efforts relating to pandemic, these investments also contributed to long-term health system strengthening initiatives that further advanced our goals towards universal health coverage. Indeed, COVID-19 has certainly impacted coordination and assistance by broadening our networks, engaging new partners, and certainly increasing the nature and magnitude of coordination and assistance to Solomon Islands. Capitalizing and drawing from the strategic lessons of COVID, the Ministry of Health hopes to have relevant strategies to be incorporated in the malaria response towards elimination. As part of our roadmap, the ministry is planning to set up Malaria Elimination Committee, as mentioned earlier, at the provincial level and comprising of members from the health sector and other stakeholders. This is to facilitate the health system strengthening and to integrate between provincial governments and community stakeholders. Thank you so much.
Thank you, Dr. Albee. That's an incredibly helpful overview, of the coordination and collaboration within Solomon Islands. I had one last question for both of you, actually. In your roles as, the directors of disease control programs in your respective countries, you, just through this conversation, you've highlighted some very interesting case studies of, the way you were able to integrate disease elimination approaches, the way you were able to, bring together political commitment at the national and subnational level. So the question specifically is, how were you able to mobilize support for the policy change process that was needed to bring this together? Given that in public health, a lot of these diseases tend to be siloed, and what you're talking about and demonstrating through your work is really bringing everyone together, this kind of multi-stakeholder, multi-sectoral approach. So would love to hear your experience and how this was made possible, both in the Philippines and in the Solomon Islands. So Dr. Howe, if we could start with you.
Yes, thank you, Amita. And I guess I would preface my answer by saying that especially this integration is continuing to present itself to be a work in progress. So as you mentioned, it was not an easy decision, and daily it's not an easy decision to defend because people have been used to thinking of one disease at a time. But I guess what has really helped is this openness to communication and collaboration, both from the end of government and also from the end of the implementers that we're dealing with, assuring them that in this integration, we are actually not leaving diseases behind, but we're actually now mainstreaming diseases to be part of standard care or to be part of standard practice. Instead of them trying to fight for the attention of decision makers at the same time. So concretely, what we've also done is develop integrated policies and strategy papers to explain some of the shifts. So one thing that my office is also working on is an integrated omnibus guideline by life stage, which actually integrates all the things that you need by a life stage. And a part of that would be integrated elimination strategies relevant to specific settings. Again, all of these are work in progress, but them seeing what an integrated plan can look like actually brings also the confidence to them that the status quo that they've been used to is actually not being lost. And I think it also helps that we've actively communicated that the priority interventions of the government for population-based activities are national immunization as one, and second is the elimination strategy. So putting it also higher into the agenda, but now to be an integrated strategy has also built up that level of buy-in and that level of confident. So I hope this is something that the Philippines is trying to embark on. If it inspires other countries, we hope that you do the same, and we hope to also learn from how other countries are doing this shift. But we all know this is what we need to do for integrated life stage-based care and universal healthcare also. Thank you.
Thank you, Dr. Howe. Dr. Albi.
Thank you. For the Solomons, as I think you might be aware, we have been asked to integrate as part of the reform that the ministry has initiated since 2015. We have been vertical all along, but when we were asked to like sort of pilot integration on behalf of the ministry or other programs, we have made good progress, and also we met some challenges on the way, as we focused on performance-based outcomes. Other partners, both within the ministry and in the province, still need to understand what our targets or our outcomes that we want to achieve, which is not available or is not existing in other stakeholders areas of work, and this caused some challenge in the way of achieving these targets, and so we are now focusing on the new strategic plan for the Ministry of Health, which is now in development, to try and use it to ensure that everyone understand what it means to integrate, and everyone have to have the same understanding in terms of performance-based programs like what we are working towards, the malaria elimination. So that's what we have experienced so far, but I hope that we can integrate policies, especially public health ones, and also community-based policies, and especially malaria elimination plan. And the main reason why we want to we are setting up the advisory committee is to put power and resource into ensuring that elimination do save costs, and it takes time for people to change. So, but with some policies and guidelines in place, from the top level down to the implementation level, I believe that we can achieve much more in terms of elimination or an integration of towards elimination. Thank you.
Thank you, Dr. Albi. Yes, completely agree. I think change is always difficult for everyone, and particularly when you're thinking about policy change, it can be a very big animal. So definitely need some sort of guiding roadmap or a document that sets out the different steps to carry everyone along on that journey. So thank you, Dr. Howe, Dr. Albi, for such an engaging discussion. I'll now hand this back to Pooja, who will conduct a short survey seeking feedback on the dashboard. Over to you, Pooja.
Thank you, Amita, and distinguished panelists, for your time and sharing your expertise with the Malaria Network joining us today. It is our collective efforts and thoughts on best practice that will bring us closer to malaria elimination. With that thought, I will now move forward to the final session, which is, as mentioned earlier by Dr. Sarthak, it is important that we keep revising our advocacy efforts to stay relevant to the varied burden and uneven progress in our region. APLMA would like to conduct a short survey to hear your views on how useful the dashboard has been for you, as well as some of the new indicators we are proposing for a refreshed Dashboard 2.0 next year. Please join us by logging on to mentimeter.com and key the passcode 821-35175. It's also, I'll just wait for the slide to come and you'll be able to access a QR code. So you can scan the QR code and then key the code 34049187. Yeah, sorry, the QR code and the code has changed. I'll give a minute before I jump to the question. I'll repeat again. We can go to use your mobile or desktop to go to the website mentimeter.com and key the code 34049187, or you can scan the QR code using your mobile phone. Okay, we can perhaps start the survey. Shubhla, if you can go to the next slide. Thank you. So first of all, we would just like to hear, how do you feel about the Leaders Dashboard being helpful till now to support policy reforms in your country, as it was super evident with the milestones that was achieved last year, as well as the policy reforms that the countries are working towards? We do see that it does link quite aptly to our current Leaders Dashboard, and we want to keep it relevant moving forward as well. If you could quickly respond to that question. Thank you.
Okay, thank you, Pooja. I didn't actually understand what you were helping us to use.
Okay.
But yeah, I just want to comment on the dashboard. The dashboard actually for our program, yes, we do use it to review our status and our achievement on an annual basis. We believe it helps us keep our leaders both at the ministry and the government level to keep to maintain their understanding and the achievement of the country in terms of what we are working towards in terms of elimination. So it's very useful. I cannot suggest any the improvements, but I think if we can review it not only annually, maybe 2 times a year, I think it will become more familiar to the program implementers as well as the leaders. I think we can share more information through this dashboard and then keep track on whether we are going green or we're going red. I think that will really help. Thank you.
Thank you. Thanks a lot. That was very candid feedback right there for us to move. It has definitely motivated me to keep the good work going, as well as we hear you on reporting not just annually, but having some other way of updating the country stakeholders on where they are and what next needs to be done. Thank you. Thanks a lot, Dr. Alvi. I will I hope everyone has been able to sign in. You have to go to the website www.menti.com and key the code mentioned earlier, like it's in the last the slide. I think we have only received 21 responses so far, and we have quite a few of us joining us today. So I will request everyone to please go to the website and sign in and give us your valuable feedback. I'll wait another 30 seconds and then we'll move to the next question. I can see now we have more responses. So please bear with us and we wait for another 30 seconds and then we'll go to the next question. Okay, I believe we can move to the next question. Please stay on the same link. You should be able to see the next question on your desktop. We want to now hear how your countries have used the Leaders Dashboard in your program activities, and in speaking with other ministerial colleagues, we would like to understand whether the dashboard has been used to highlight positive policy changes to the heads of state of your countries, or also to flag areas where collaboration across ministries is needed, whether it is for increased budget or for cross-border collaboration. As we did hear from Dr. Albi as well, it does help us support and report to the heads of government. We have several options for you to choose from, and you can select all that apply for your country. It's the same link, and this question should be coming the very next one. So hopefully no one is having any issues using the link. We'll just wait for another 20 seconds. Okay, I think we can go to the next question now. Thank you. So we have mentioned throughout the webinar today that we want the dashboard to remain relevant and useful for malaria programs in keeping the momentum to elimination. Given that most countries have achieved several milestones of the dashboard, APLMA is in the process of refreshing the indicators and are considering inclusion of components related to gender equality, disability, social inclusion, as well as granular details on the implementation of key policy milestones, such as having multi-sectoral representation in the task force, using the data that is coming from informal providers to support the malaria elimination strategy, and having post-market surveillance of malaria commodities, etc. in place. Based on the initial discussion at the Secretariat, below are the proposed indicators that we are considering including. These indicators are rooted to the 6 roadmap priorities as agreed by the leaders in the EAS Summit 2015. Please note that these indicators are tentative and will go through several rounds of consultations and iterations. The indicators will be put forth in the high-level meeting for endorsement of senior officials. We would love to hear your views on the same. I now invite everyone to please rank these indicators in order of relevance, with number 1 as the most relevant indicator and the as number 7 as the least relevant indicator. I'll quickly go through the indicators that we have proposed. Having, as I mentioned earlier, having a multi-sectoral representation at the task force, having a plan to support and plan the imported malaria elimination strategy, and so that we are aware and we are ready to prevent reintroduction. Then having a formal mechanism to use those data that are coming from informal sectors for helping us plan the implementation of elimination strategy. And few others include the post-market surveillance of malaria commodities, as mentioned earlier. Having targeted interventions for at-risk communities like the migrant workers, indigenous population, as we did hear from Director Howe today, as in the case of Philippines. Similarly, we want to have the risk stratification to be focused on having gender and age analysis so that we are aware of our at-risk communities. Finally, we will want, as earlier mentioned, as also mentioned in the Leaders Dialogue last year, we would like that we shift from external funding and the transition work has initiated. So these are the initial indicators that we are thinking as being appropriate for where the Asia Pacific countries stand in their elimination roadmap. We look forward to more other indicators that you might have, and we'll share a separate email ID where you can write to us. But for now, I would just request everyone to please rank these indicators based on relevance for your country. Great, we can, this brings us to the closing of the session today. Thank you for your participation, as well as we would love to hear your feedback on the Dashboard 2021. Please message us directly at dashboard@apelma.org. We will also type this email ID in the chat box. Now, I will like to invite Dr. Satya to deliver the closing remarks. Thank you.
Thank you, Pooja. And firstly, special thanks to Dr. Albe and Dr. Howe for making the time again to engage in this discussion and also to provide us with truly substantive insights based on your experiences of your programs. Secondly, I want to thank everyone who joined for taking time out of their very busy schedules. I think just the act of joining this is indicative of a level of solidarity that does exist. And what we want to make sure in terms of the dashboard and the roadmap is that we can emerge with something moving forward that is of utility to the countries that are on this call, with an understanding as well that our function as APLMA is to be able to engage in technical advocacy. That is to say, we want to engage political leaders in a way that's grounded in data and reflects what the priorities need to be. And with that, the very last thing that I want to say is really two things. Congratulations to all of those who are continuing the fight despite all of the tremendously challenging circumstances that continue to endure. I mean, I think we hear a lot about in a lot of press about a pandemic that is waning or that people are ready to move on. We also know that many countries within this region have vaccination rates for COVID that are below 20%. And just as it is true for COVID, that the pandemic is not over anywhere until it's over everywhere, the same holds true for us as we engage in this fight in malaria elimination. And so with that, it is a congratulations to all of those on continuing the fight, on the substantive progress that's been made on the dashboard to turn so many yellows to green. But let us not forget that our collective action is required to take those reds where we find them in so many of the pockets where the systems are the weakest. And let's ensure that we can also end the oldest pandemic that is malaria there, so that we can end it everywhere in Asia Pacific. Thank you so much. APLMA APMEN will be co-hosting with the Government of India, Sierra, and other partners, senior officials meeting November 11th, 2022. So I look forward to seeing many of you there, and so grateful to you all for making the time. Be safe, everyone. Thank you. Over to you, Pooja.
Thank you, Dr. Sathak. This brings us to the end of the event. I thank everyone joining us today and hope you enjoyed the event. Please don't forget to fill the post-event survey, and I welcome everyone to check out our website for regular updates on the upcoming webinars and policy resources. Thank you and bye-bye.